Hello, everyone. My name is Rob Ferry. I am the program director for the point-of-care ultrasound program at IU School of Medicine. I wanted to just quickly update you on some Phase 1 POCUS changes coming to the curriculum that we propose starting in academic year 2025-2026. So big picture curricular goals I'll discuss. I'm also going to run through what the proposed changes are for this coming academic year, the financial and contact hour impact, and some mitigation strategies that I would propose. So what's the big picture POCUS curricular goals for medical students here at IU School of Medicine? So this should really mirror the way that they're trained in other physical exam type modalities. People have described point-of-care ultrasound as the new stethoscope or the stethoscope of the future. So framing it in that way I think is helpful. So in Phase 1, the purpose of the POCUS curriculum is to learn to perform point-of-care ultrasound in a controlled environment. And then in Phase 2, as they're going out into the clinical space, they're learning to do it in a clinical environment where patients are different, things are sort of messy because patients have less ideal body habitus, or they may be uncomfortable. And then they're going to learn to report those findings. And then finally in Phase 3, they not only perform and report on point-of-care ultrasound, but they begin to really synthesize all of the data, including what they've obtained from the point-of-care ultrasound, to form a diagnosis and then begin to formulate a treatment plan. So what do we need to accomplish this? So a core part of this is having baseline competency in performing point-of-care ultrasound in Phase 1. In Phase 2, they should go out and be able to independently perform exams. They're going to continue to grow in their ability to do this, but then they're going to learn to report and think about reporting those findings. And then finally, in Phase 3, they're continuing to build competency and using point-of-care ultrasound as part of an approach to a patient. What's going to be key in this is doing assessment. And so our plan is to do skills assessments as part of Phase 1 to ensure that they have that baseline competency. For the past 2 years, we've included point-of-care ultrasound in the CPX exam under a practice version of that CPX of a CPX case. And then in Phase 3, we're going to test this in a patient simulation during the emergency medicine orientation. To sum it up, the Phase 1 POCUS goal is really that a student, when they complete Phase 1, they will have baseline competency to perform 3 core point-of-care ultrasound exams. And this is done before they show up to their clerkship. So what's our strategy? So there's 3 things that we're going to do. The first one is we really need to simplify our labs. We need to focus our hands-on training on just 3 exams. Currently, they're taught 7, and we need to reduce that and focus that to 3 exams. The second thing that we're going to do is I feel like matching the structure of FCP1 and FCP2 is important, partly because students understand it, partly because the Phase 1 leadership understands it. And so basically, this would be 3 labs plus a hands-on assessment for each of FCP1 and FCP2. There's quizzes that are contained for that exam type for that session. And then finally, we need to add assessment. And so these will be both knowledge and skills assessments. The knowledge assessment will occur through quizzes that will be part of each of these labs. And then finally, the skill assessment will occur at the end of FCP1 and FCP2. What's key in this is that students need to know that this counts towards their grade. It's not currently true today. In FCP2 it does, but in FCP1 it does not. So currently, we're teaching 3 exams in FCP1, but we're teaching 7 exams in FCP2. Currently, there are quizzes in FCP1, but they don't count towards their grade, and there's only 3 labs. They don't have a skill assessment. In FCP2, there's 4 quizzes and 4 labs, but the last lab is where we do our skill assessment. What I'm suggesting as our new approach and new change is that we focus on cardiac, fast, and lung exam as our core hands-on modalities. We have them see this both in FCP1 and FCP2. During the lab and as part of the pre-lab material, we're still going to talk about a few additional exams. Aorta is a core part. We're going to talk about the liver and gallbladder. We're also going to talk about the kidney as well. When they're doing the FAST exam, they're imaging the kidney and also they're imaging the liver. So we're not going to focus on these exam types, but they'll still be seeing and identifying those organs. The change for FCP1 is that we're going to add an additional lab. That lab is essentially going to be the skill assessment session. In FCP2, we're just going to take away one of our quizzes, and again, that last lab, the sole focus of this will be to be that skill assessment. So how are we doing labs today, and what will be different? So currently, campuses should be having 60-minute labs. Those facilitator guides call for some anatomy review and then hands-on training. What I would like to do to help students understand and look forward so they have a larger arc of the curriculum is that in addition to anatomy review, that we also introduce some pathology, really simple basic pathology, but as a contrast to normal, and also use that one pathology to demonstrate how that would be used and do that through a presentation of a clinical case. This would be very fast, very simple, not a long discussion about the clinical case, but something that I think will help students recognize how POCUS is used clinically. I think to be successful, we really should have a 90-minute lab, but I recognize that going and adding an FCP1, an additional lab, and making those labs 90 minutes may be a bridge too far this first year. But I would propose that we consider doing this starting in academic year 2026-27. So in summary, here are the changes. For the knowledge-based assessment or quiz, we are going to have one less quiz for FCP2. And we would have quizzes in FCP1 count towards their grade. Hands-on, we would add one 60-minute lab. That one 60-minute lab for FCP1 is just would be used for assessment. Beginning in 2026-2027, we would look to add an additional 30 minutes for the 3 labs where they're learning new material. And then finally, skill assessment. Currently, we do not have skill assessment as part of FCP1. We would add that to FCP1, and that would count toward their grade. So what are the impacts? So what are the financial impacts? So the financial impact for 2025-2026 would be an additional $210 for each regional campus. Again, it impacts FCP1 only. This is assuming 2 models that we would pay for 3 hours for that lab at $35 an hour. For 2026-2027, we're adding an additional total of 1.5 hours of lab time, which using that same assumption would increase the cost to $105 total dollars for FCP1. How about the additional curricular time and contact hours? So for academic year 2025-2026, we are only asking for a total of 1 additional contact hour. In 26-27, we would need an additional, on top of that 1 hour, an additional 1.5 hours. I'd anticipate that study time would increase as well, especially because students would know that there's a skills assessment, which would probably increase the total study hour time to about 2 to 4 hours. I think there's a lot of things that can be done to mitigate the financial impact. One is every campus has a Vimetic simulator, and there's no reason why these Vimetic simulators can't be used for the lab. So we could have a Vimetic simulator and a real model for each lab. That would be a total cost savings of $315 because you would essentially just cut out the need for one model. The other thing that I think is hugely impactful, especially for students, to make labs better is by including student ambassadors. Currently, Dr. Audrey Herbert runs a POCUS summer program for students between their first and second years. It's usually the first 2 weeks of the summer. And they go through the entire curriculum. They get a lot of hands-on experience. They do over 100 exams. They're taught how to teach others, and then they have to pass some type of a competency assessment for each of these core exams we're teaching. They can assist with the lab and help with students in preparing for assessments. The great news is we've created both the POCUS Probe and Golden Probe Society. Once they come out of the summer program, they'll be part of the POCUS Probe Society, and any time that they spend helping in lab will count towards a requirement that they have for the POCUS Golden Probe Society. There's a little more details about each of those societies, and I can send more information if you're interested. I appreciate your time. Hopefully this helps. Please reach out if there are any questions. Thank you so much.